It's really hard to ignore how much technology is weaving itself into our health and even the policies around it.
Definitely. And that's exactly what we're diving into today. There's this upcoming event, the 16th Annual Health Equity Symposium.
Right, and our focus is squarely on that symposium, specifically how it's looking at artificial intelligence, AI, and its role in, well, health policy and how healthcare is actually practiced.
Exactly. It sounds pretty important.
It does. And for anyone listening who might be interested, it's happening soon. Thursday, May 8th, 2025, runs from 2:00 p.m. to 4:00 p.m.
Okay, good to know.
And it's in Boston at the Joseph B. Martin Conference Center. They've specified the Pichette Room. So
Right.
if you happen to be in Boston, might be worth checking out.
And the core theme, the big question they're tackling and what we're digging into is really, how can we actually use AI to, promote health equity? Not just use it, but use it for good.
That's the key, isn't it? And to answer that, they've assembled, well, quite a panel.
Oh, yeah. Who's speaking?
Well, first up, there's Dr. Leo Anthony Saley. He's got an MD, MSc, and an MPH. That's the Master of Public Health, so he's looking at population-level stuff.
Okay.
He's a senior research scientist at MIT, involved in computational physiology, basically using big data to understand how our bodies work. And he co-directs MIT critical data, so very data-focused.
Right. Makes sense for an AI discussion. Who else?
Then there's Dr. Fatima Parouk, also an MD, but her background is interesting. She's been a healthcare and digital strategy advisor and was chief health officer at Salesforce.
So bridging the tech and healthcare worlds from a corporate strategy perspective, that's a valuable angle.
Exactly. Then Dr. Felicia Collins, MD, MPH again, and FAA Fellow of the American Academy of Pediatrics. She's a physician, public health leader, and importantly, a member of the Reede Scholars.
The group organizing the event.
Precisely. And rounding out the panel is Dr. Hawazin Alani. She has a BDS, Bachelor of Dental Surgery, and a PhD.
Oh, interesting. Oral health focus.
Yes, she is an assistant professor at Harvard School of Dental Medicine in oral health policy and epidemiology, so looking at patterns and policy in dental health. Plus, she's also with the Health Policy and Management Department at Harvard's T.H. Chan School of Public Health.
So a real mix of clinical, data science, strategy, public health, and even specific fields like dental health. That's comprehensive.
It really is. And we should definitely mention Dr. Mary Fleming, MD, MPH, FCOG, which means she's a specialist in obstetrics and gynecology. She's the current president of the Reede Scholars. Her leadership is obviously vital here.
Okay, got it. So quite the lineup.
Yeah. So with this panel and this really critical topic, our mission today basically is to sift through what we know about the symposium's agenda and aims, trying to understand how AI could potentially help narrow those persistent gaps in health outcomes.
Sounds good. Where should we start? The core role of AI.
Yeah, let's jump right in there. Understanding AI's role in health policy and practice. One of the symposium's stated learning objectives is exactly that, getting insights into how AI can identify and, maybe more importantly, address health disparities.
Okay, so not just finding problems, but fixing them.
Right. And thinking about Dr. Selly at MIT, you can immediately see how analyzing massive patient data sets could uncover hidden patterns, couldn't it? Like seeing disparities across different groups that weren't obvious before.
Absolutely. That computational power applied to health data is huge. And then you bring in someone like Dr. Parouk with that digital strategy background.
Right.
She can probably speak to, well, how do you actually build and deploy AI tools? How do they fit into the workflow to reach underserved communities effectively? It's not just about the algorithm.
Good point. And Dr. Collins, with her public health hat on, she'd be focused on making sure these AI applications actually improve population well-being, not just individual metrics, right?
Exactly. The bigger picture. And Dr. Alani brings in that crucial reminder that health isn't just one thing.
Like oral health.
Yeah, AI could potentially analyze access patterns for dental care or outcomes, showing inequities there too. So it seems like a major goal is just exploring the sheer breadth of AI applications across different health domains.
Makes sense. But using AI in health, that immediately brings up ethical questions, doesn't it?
Oh, absolutely. And that's clearly another major focus, another learning objective for the symposium, the ethical side, the responsible use of AI in health policy.
What does responsible use likely mean in this context? I mean, beyond just the basics.
Well, it's got to involve thinking about bias, right? AI learns from data, And if that data reflects existing societal biases,
Then the AI can actually perpetuate or even amplify those biases. Yeah, that's a huge concern.
huge. So discussing how to detect and mitigate bias in algorithms will likely be key. And then there's data privacy. We're talking about highly sensitive health information.
So ensuring patient confidentiality, data security, that has to be paramount.
Paramount. It involves thinking about who gets access to the data, how it's anonymized, how it's protected. These ethical frameworks are essential.
Which leads directly into data governance, doesn't it? That's another learning objective they mentioned.
Exactly. You need rules of the road. Best practices for data governance to make sure AI is used equitably and responsibly. It's about setting up the systems and policies before you fully unleash the tech.
So what would best practices look like? I mean, this field is moving so fast.
That's the challenge. But generally, it probably includes things like transparency, knowing how an AI reaches its conclusions as much as possible.
So doctors and policymakers aren't just dealing with a black box.
Right. And clear protocols for data collection, storage, access controls, use limitations, maybe even audit trails to see how data and AI are being used. It's about building trust and accountability into the system.
Okay, that framework seems critical. Now, theory and ethics are vital, but they also plan to look at real-world examples, right? Case studies.
Yes, and that's often where things get really interesting. The symposium aims to review actual applications where AI has already been used to try and advance health equity.
I always find that helps make it concrete, moving from the what if to the what is.
Definitely. These case studies show what's possible, maybe highlight successes, but also probably reveal challenges faced during implementation. Learning from practice is invaluable.
So we might hear about, say, AI helping improve diagnostic accuracy in areas with fewer specialists, or tailoring prevention programs based on community-specific risks identified by AI.
Precisely those kinds of things.
Yeah.
Showcasing tangible examples of AI tackling disparities and hopefully improving outcomes. That's the goal.
It's good to also take a step back and look at the organization running this, the Reed Scholars, Inc. They sound quite established.
They do, and very active, it seems. The materials mention they have elections coming up right before the symposium Wednesday, May 7th, for President-elect, Secretary-elect, Treasurer-elect.
Oh, interesting timing. And their leadership structure caught my eye.
How so?
This idea of serving a year as an elect for sort of shadowing the current officer before starting the actual 2-year term.
Huh. That's smart, like built-in mentorship and ensures continuity, avoid someone coming in completely cold.
Yeah, it suggests a real focus on sustainable leadership. And get this, the current president, Dr. Fleming, will have served 6 terms, so 12 years, by 2026.
Wow, 12 years. That speaks volumes about the organization's stability and, you'd imagine, the depth of knowledge there. They called it impressive intellectual capital.
Seems fitting. And they're actively looking for new leaders, too. There's a call for nominations with a contact email for a Dr. Brian Swan.
So they're established, but also clearly looking to the future and encouraging member involvement.
Right. And they even extend an invitation for others interested in health equity to join them, putting a barcode right there for their website. Seems like a good time to get involved if this is your area.
Definitely looks like a well-grounded organization tackling a very modern problem.
So wrapping this up, as we look ahead to this 16th annual Health Equity Symposium, it really feels like AI is poised, or maybe it's already starting to play a pretty significant role in this whole health equity space.
For sure. We've talked about its potential to identify disparities, maybe even help address them, and the symposium clearly aims to highlight real examples of that.
But, and this is crucial, it's not just about the tech. The focus on ethics, responsible use, data governance, that's absolutely key.
Couldn't agree more. You need those guardrails. And having organizations like the Reed Scholars leading these discussions, bringing together diverse experts, that's how you navigate these complex issues carefully.
Yeah. It really is this intersection of, cutting-edge technology and dedicated people and organizations working on these long-standing equity issues. It makes you wonder, doesn't it? How can we best steer these powerful new AI tools, guided by that kind of thoughtful leadership and a real commitment to fairness, to finally start closing some of those persistent health gaps for everyone?
That's the million-dollar question, isn't it? How do we make sure this technological leap forward truly lifts everyone up? Something to keep thinking about.